So I'm going to try and capture some highlights of that work over the past 12 months, and we're going to go pretty quick. This is a prelude to an annual report document that we're putting out. This is our third annual report that we've done, our first 2015, and I encourage you when this comes out by email. We'll also have some print copies if you'd like one. Take a look through and let us know your thoughts and interests and challenges that you're facing and how we can continue to move forward. But again, it's all of you and your contributions that have filled this report pages with so much content. The first draft that Carolyn Cartwright put together, and I'm so grateful for, was 20 pages. And we realized that none of you are probably going to read 20 pages. So we're in the process of trying to really hit the height. The information that I'll share today is by no means comprehensive, and many of you have a lot to add and share that's been done to fill these slides quickly. So thank you for making this coalition what it is and building us where we're at and where we're going. How many of you have spoken at our general membership meeting this last year? I see some hands in the audience. Fantastic. For those of you that haven't raised your hands, please join us in the next 12 months. We'd love to have all of your organizations share. These are intended to be opportunities and learn best practices for us to share our successes and a chance to develop a common understanding of the plans of the community and state. So please, in 12 months, if you're interested in sharing at these meetings, come join us. If your executives are interested in coming and speaking at an introduction session like what you heard Chandra do last afternoon, please invite them to come and present the great work your organization is doing and how they're integrating this process, this work of emergency preparedness and response into your organization's quality improvement process. Raise your hand. These meetings are successful because of your willingness to share. And if you ever have anybody to ask, always the same time, 4th Thursday of each month, same place. We've done some great publications this last year. The newsletter, hopefully all of you have been receiving. We put that out every other month. So we're here in person on the odd months, and on the even months, we have a newsletter going out. Hopefully it's a long form articulation of the same best practices, plans, and resources that are out there. Once again, we'd love to highlight your organization's successes. So please use our email, hcc@srhc.org, to set some information there. If you're not receiving these, you have to add to your distribution list. We have also made a change this last year, thanks to Hannah and Carolyn's work, to move us to MailChimp, which is an email platform. Hopefully our products are more polished. Hopefully our products are more readable and more usable as you're using them. Who loves Drool? Maybe you heard me say this was a good expect this to be a challenge for all of us to cope with you to meet your needs. Provide you access to the regional plans that are in play, develop. We've held many meetings that I've joined many of you on at your facility over the last year, focusing on different elements of this process. Show of hands for 7 months. The CMS rule compliance date is November 15th, 2017, 45 days away. Most of us are kind of very aware of that reality when I look across this audience. Who would like these CMS sessions that we'll host at the end of this meeting to continue after the end of this year, this compliance date, essentially? We'd like to continue collaboration at a provider type level and continue to develop enhanced planning. Thanks for that feedback. The Healthcare Coalition had an interesting challenge this year of adapting to the new expectations that Erica Henry alluded to. Our program is guided by a federal document that you see in front of you, which is the Healthcare Preparedness Response Capability. We have 4 guiding principles. 1, making sure we're organized in a way that can serve your needs as healthcare providers. 2, making sure that there is an opportunity for response that works in an integrated way, sharing resources, sharing plans for better outcomes. 3, making sure that all of you are able to maintain your services by working with the appropriate agencies and have the appropriate planning in place. And then 4, making sure that we can do exactly what Erica and Bill and Holy Family Hospital and the province have been working on so hard around the Disaster Medical Coordination Center, making sure we can handle a medical surge when that occurs. This was an interesting challenge for us to adapt to the new framework and build into the work that we're doing. And I think we've done a reasonable job starting down that path. To that end, Erica mentioned the reframing of the coalition structure in the state of Washington. We we embarked on that process this year, working with Columbia County as one of the counties to figure out how they were best aligned. And then, as you heard, the multi-regional services that have been developed across Eastern Washington, and being able to bring those online here, based out of Spokane, but serving all of Eastern Washington. Okay. More detail? Cool. It's in a report you can read afterwards if you want more detail, and you've got our email. We've been doing WatchTrack trainings all year, and I am really grateful that Hannah was able to share these numbers with me. And Hannah and Carolyn did a great job coordinating these. But we've had 8 agencies added through this annual report period. And then even in the past several months, I want to recognize some of the organizations that are in this room: Chaz and DaVita, Inland Northwest Blood Center, Kindred at Home, Spokane County Medical Examiner, Sunshine Home Health. All of these agencies have joined us in using WatchTrack as a common tool to be able to share information, respond to events with coordinated information, and understand where there's bed availability and resource availability. So thank you to all of you for investing the staff time to do that training. We posted 4 trainings over the past year and added 113 accounts. 68 people have attended those trainings. And I should say 4 trainings. We actually did like 6 trainings at the Fire Training Center, so I'm going to go with 10 over the past year. But a tremendous amount of staff time and investment into using this tool. And that's not, all of us know that the cost of investment when it comes to this work and making sure that we're able to use these tools. So thank you for working with us to make sure this is available and something that's valuable to your organization. If you have any questions about WatchTrack, feel free to call us. We are your regional administrators, and you can add accounts, add agencies, and make sure that there's access where appropriate. January was a really busy month for us. January 5th through February 6th of 2017, Eastern Washington started to assess our information here in the 10 counties and subscribes of Eastern Washington around the impact of the influenza season we're seeing. Western Washington was well over capacity, and placement of patients was a real challenge in Western Washington. We sent out just a report or request for information. Many of you sent information back to us that we aggregated into our situational response report, and then sent that back out to our emergency management and public health partners along with all of you. Hopefully this process was useful. We certainly received feedback from all of you. These are some of the comments from folks that did receive and use those reports, and how valuable it was in organizations' emergency response planning, whether that was assessing the levels of pharmaceuticals available, whether that was understanding what would happen to our system's referral patterns if we did see that same spike in curve here in Spokane County. And this is definitely a process we'll continue to move forward with. Since this event, Hannah's led a great improvement process that has allowed us to improve the way we assess information. We used to send information out by email, request your information back on a Word document, and then aggregate it. And that was prone to human error and a little slow. So we've upgraded that to a new survey tool that can be used over phone, over email, however that works with your 3D contact list. But it's faster, more accurate, and less prone to human error when transferring data on the back end. So we're pretty grateful for those improvements and the path forward. But know that this is something we'll utilize again and again, whether it's influenza, wildfire, any kind of impact to our healthcare system. Sharing information so all of you can make appropriate operational decisions on how to best serve your patients is an essential part of the service that we've been providing for the past. You heard Erica talk about the crisis standards of care work happening at state level, both with the upcoming public processes as well as the Disaster Medical Advisory Committee. We've got a local chapter of that here in Spokane County that's been meeting in coordination with the Health Coalition and Spokane Regional Health District. We're really grateful for those of you that have volunteered your time to go through the difficult processes of questioning what are the legalities of allocating scarce resources, what are the moral frameworks for those scarce resources. This is a committee that will continue forward in the next several years to come as we work through this crisis standards of care work, both at a local level and state level. Do you have any clinicians or physicians who are interested in joining this and helping be part of that advisory group that could work with a public health officer at time of need? We welcome that participation. Last year, we had great investment in time and energy in developing patient tracking. Those of you that we talked about CMS just a minute ago, how many of you are interested in patient tracking as a resource that meets your CMS compliance rules? Show of hands if you would let me. Thank you. The patient tracking committee is intended to create the policies and procedures to use the tool available to us through WatchTrack. And we had a successful exercise of that this spring when we did our Bloomsday recovery tabletop exercise that also had a concurrent WATRAC tabletop in it. That gave us some great feedback about how this will be used going forward and give us a good idea of the next steps for that committee, which will be to continue to exercise on a bigger scale and continue to develop better WATRAC usage so people can use this at time of need. We're a long ways away from being ready to use this at a drop of a hat across the entire region, but we feel it's an incredibly valuable resource going forward. Your agency does have a need to track and maintain awareness of patient movement from your facility to another location through an evacuation. This is definitely a tool that could be useful. So we welcome your involvement and continue to advance the work of patient tracking. Thank you to Providence for leading us into the next evolution of our work. Originally catalyzed by Ebola in 2014 and 15, we've learned a lot about highly pathogenic diseases and the need to continue to prepare and respond. All of you as healthcare providers are frontline facilities in this work. And thankfully, we have a state framework and a multi-state framework that allows us to utilize the incredible national level excellence at Providence and be able to roll up from a frontline to assessment to treatment facility where appropriate. I was exercised during this frozen contagion exercise earlier this year. A lot of lessons learned around interstate transportation. And Daryl, if you'd raise your hand, if you have any questions about that work they're doing, I'm going to put Daryl on the spot as a follow-up after this meeting. There's some great content, some excellent videos. If you haven't seen them around this exercise, we're happy to share. And it's a really excellent example of pulling partners together and thinking big about solving a high impact event like this. Another series of exercises, I appreciate what's coming for all of us around CMS compliance, and there's a lot of exercises over the past 12 months. We need to make sure we take the opportunity to recognize the work that went into these. These don't come easily. As any of you know, whether it's doing your internal tabletop or during doing exercises within your community, there's a fair amount of energy and effort that goes into these. This photo here contains moulage from Bruce in the back row there, and was at Bill's hospital at Pullman Regional Hospital. I had a chance to attend the Whitman County, and it's only one example of the many exercises we were able to interact with and participate in. But this full-scale exercise at the end of last year was a great example of pulling together community partners to meet everyone's expectations to advance the capabilities that are expected of our agencies. This was done in a very, very short amount of time, and it's an excellent example of what's possible when people come together. We have a great presentation from Bruce and Bill on file. If you need to watch any background previous exercises or other resources, we have all these recorded on our YouTube playlist and then available through our website with some interim modifications. We conducted 3 major trainings: hospital evacuation, shelter-in-place exercise, or training, a triage and treatment for non-hospital provider types by DOH, and then a mental health training. How many of you attended one of those 3 trainings? Anybody in the room? I see several hands going up. Thank you for investing your time. We'll continue to try and figure out, we do an annual assessment of need. We want to know what you need. What are the things that your organizations feel would be valuable to train on at a community level? Each of you have internal training for competencies, but how do we start to aggregate those across the region and within our county? We'll send out a survey in the next month or 2 that allows us to assess what your needs are based on topic area. Please give us feedback. Let us know what you're working on internally so we can find the commonalities that allow us to make a shared efficiency across the organization. You heard Ed mention our staffing model, which I'm really excited about. We went through a lot of changes in the last year. A major thanks to those that have been with us previously. Elena Mira, focused on patient tracking and our member communications, and Ryan Trailer on our information sharing and response protocols. We have some wonderful new individuals that have joined us, and certainly if you haven't met Carolyn, please introduce yourself at the end of this meeting. And then you'll hear more from Casey here in a little bit when we dive into the next session of our agenda. We're really excited about continuing to serve all of you, and so please let us know how we can best continue to do that. Format, processes, we do need your feedback. You'll also get a survey about kind of your satisfaction. We always do an assessment of our work and hope that you can give us feedback about how to continue to best evolve these meetings, these newsletters, the training, the exercises we have planned. In the next year, definitely continue to focus on CMS. I'm going to, it's an exercise you'll hear about in a minute. That work will continue over the next year as a high priority for us. Continuing to evolve and develop patient tracking as a resource that can help all of our needs when it comes to understanding where patients are located and where they're going. We'll definitely continue to develop our organizational structure, find additional opportunities for input. And then our planning process will become more enhanced through development of a preparedness and response plan specific to the coalition. Many of you coming into the CMS work have asked us, well, just tell me what to do. What's our organization's role? We know we have to do certain things for CMS, but how does that fit into the community framework? This planning process will definitely assess some of that work, which is to basically clarify the roles and responsibilities by provider type and how we all fit in. What should hospitals expect of skilled nursing facilities? What skilled nursing facilities expect of blood centers? What should blood centers expect of dialysis? Weren't exactly linear lines, but what are the roles and responsibilities from organizations as we come together and build a unified response process across counties, across markets, and across our patient